If you're a woman over 60 and you've been feeling off, tired in a way that sleep doesn't fix, gaining weight without changing anything you eat, feeling cold when no one else in the room is, there's a condition your doctor may not have tested for recently, and it affects women over 60 at a rate that most people find surprising. Thyroid disease is the most underdiagnosed hormonal condition in older women in the United States. Studies estimate that as many as 1 in 5 women over 60 have some degree of thyroid dysfunction, and the majority of them don't know it. Not because the condition is rare, because its symptoms, in older women specifically, are almost identical to the symptoms of aging itself. Today I'm walking you through 7 signs that your thyroid may not be functioning properly after 60. Signs that are routinely dismissed, attributed to menopause, to stress, to getting older, and what you need to ask your doctor to test for specifically. Stay with me to the end, because the test most doctors order is not always enough. Welcome back. On this channel, we focus entirely on health after 60, because the medical picture at this stage of life is more complex, and the consequences of missing something are higher. The thyroid is a small gland at the base of the throat that produces hormones regulating virtually every metabolic process in the body: heart rate, body temperature, energy production, digestion, mood, and cognitive function. When the thyroid produces too little hormone, hypothyroidism, every one of those processes slows down. When it produces too much, hyperthyroidism, they speed up in ways that can be equally dangerous. After 60, thyroid function naturally declines with age, making it harder to distinguish disease from normal aging. And the symptoms of thyroid dysfunction in older women overlap almost completely with those of menopause, cardiovascular disease, depression, and cognitive decline. Conditions that tend to get diagnosed first. The result is that thyroid disease in women over 60 is frequently missed for months or years. Sign number 1. Fatigue that doesn't respond to rest. When thyroid hormone levels are low, the mitochondria, the energy-producing structures inside every cell, operate at reduced capacity. The result is a fatigue that is cellular in origin. It doesn't improve with more sleep. It doesn't improve with rest. It is present in the morning, worsens through the day, and is often described as a heaviness, not just tiredness, but a physical effort required to do things that previously felt effortless. After 60, this kind of fatigue is almost universally attributed to aging or poor sleep. But when it is persistent, disproportionate to activity level, and accompanied by any other sign on this list, thyroid function needs to be part of the evaluation, not an afterthought. Sign number 2. Unexplained weight gain despite no change in diet or activity. The thyroid regulates the basal metabolic rate, the speed at which the body burns calories at rest. When thyroid hormone levels fall, that rate drops. The weight gain associated with hypothyroidism is typically gradual, 1 to 2 pounds per month, and resistant to dietary and exercise changes that would normally produce results. Weight gain that is unexplained by any change in eating or activity, accompanied by bloating and fluid retention, and unresponsive to reasonable dietary effort, is a clinical pattern, not an inevitable consequence of age. If your weight has been creeping upward over months with no clear explanation, thyroid function belongs on the list. Sign number 3. Feeling cold, especially in the hands and feet when others are comfortable. Thyroid hormone is directly involved in thermogenesis, the body's production of heat. When levels are low, the body produces less heat and sensitivity to cold increases significantly. Hands and feet are typically the first areas affected. Cold intolerance that has worsened noticeably over months, particularly when combined with fatigue and weight changes, is a recognizable clinical triad for hypothyroidism. It's worth noting specifically when you speak to your doctor, because it changes the interpretation of the other symptoms. Sign number 4. Hair thinning, hair loss, or changes in hair texture. The hair follicle is highly sensitive to thyroid hormone fluctuations. In hypothyroidism, hair growth slows, the growth cycle shortens, and the hair that does grow tends to be drier and more brittle. The loss is typically diffuse, affecting the entire scalp, and may also affect the outer third of the eyebrows. Thinning or loss of the outer eyebrow hair in an older woman is considered a notable clinical sign specific enough to prompt thyroid evaluation, even without other symptoms. Hair loss that is accelerating comes with texture changes and appears alongside other signs on this list is a pattern, not simply aging. Sign number 5. Cognitive changes, brain fog, slow thinking, memory difficulty. Thyroid hormone is essential for neurological function. Low levels slow neural conduction, the speed at which signals travel through the brain, producing cognitive sluggishness that affects memory recall, word retrieval, and concentration. People with untreated hypothyroidism frequently describe thinking through fog. The cognitive symptoms of hypothyroidism are almost identical to early Alzheimer's. The critical difference is that thyroid-related cognitive decline is reversible. With treatment, function typically returns to baseline. Dementia-related decline is not. If cognitive changes have appeared in an older woman, thyroid function should be evaluated before a dementia diagnosis is considered. Sign number 6. Constipation that is worsened without a clear dietary explanation. The digestive system relies on thyroid hormone to maintain normal motility, the rhythm of contractions that moves food through the intestines. When thyroid levels drop, that rhythm slows. The result is constipation that is persistent and less responsive to the dietary and hydration measures that normally address it. Constipation that has worsened gradually over months, particularly when accompanied by other symptoms on this list, warrants a thyroid evaluation alongside a standard gastrointestinal workup. Sign number 7. A slow heart rate, or, in some women, palpitations and irregular rhythm. Thyroid hormone directly affects cardiac function. In hypothyroidism, the heart rate slows and blood pressure may rise. In hyperthyroidism, less common but more dangerous in older women, the heart rate accelerates and may become irregular, including atrial fibrillation. Studies have found that even subclinical hyperthyroidism, levels technically within the normal range but at the higher end, significantly increases atrial fibrillation risk in older women. If you have new or worsening heart rhythm changes, request a thyroid evaluation if one hasn't been done recently. Here's what most people don't hear. The standard thyroid test most primary care physicians order is a TSH, thyroid stimulating hormone. This measures the signal the pituitary gland sends to the thyroid, not the actual hormone levels in the blood. A TSH within the normal range does not rule out functional thyroid problems in older women. If your symptoms are consistent with thyroid dysfunction and your TSH came back normal, ask your doctor specifically about free T4, free T3, and anti-TPO antibodies, which can identify autoimmune thyroid disease even when hormone levels appear normal. These are standard tests. They are not experimental. They are simply not always ordered on the first pass. Which of these 7 signs do you recognize? Leave a comment below. I read every single one, and your experience might be exactly what someone else watching this needed to hear. If this was useful, share it with a woman over 60 in your life. Thyroid disease is one of the most treatable conditions in older adults, but only when it's correctly identified. And if you're not subscribed yet, new videos every week focused entirely on health after 60. No ads, no products to sell. I'll see you in the next one.